So, good morning, ma'am. I'm Chrismy Isariba and I'm going to perform the procedure about cleaning sutured wound and applying sterile dressing. So first, we need to check the doctor's order for wound care and then assess the current dressing for excess drainage, saturation, and bleeding to determine if there's a need for change of dressing. And then prepare all equipment. So the equipments needed in this procedure are sterile gloves, sterile dressing, sterile cleaning solution, tongue blades for application of ointments, plastic bag or appropriate container for waste, tape, clean gloves, sterile forceps, sterile container for cleaning solution, sterile gauze dressing, gauze swabs or cotton balls. So next, perform hand washing. So let's assume that I'm done washing my hands. Next, identify client and explain the procedure to him or to her. And then provide privacy. It is important to provide for clients' privacy. And then assist the client to a comfortable position where the wound can be easily exposed. Cover the client with a bath blanket with only the wound exposed. This allows access for wound and prevents soiling linens. And then next, put a plastic bag or container for soiled dressing within reach. So I have here a plastic bag, so I will tape it here to secure. And then next, put on a pair of disposable gloves. So since it is a clean glove, so I don't have to follow the principle of sterile technique. This prevents contamination of hands and reduces infection transmission. So next, loosen the adhesive tape of the dressing by holding down the skin and pulling gently the tape toward the wound. Remove the dressing carefully. Apply NSS to the area around the dressing that sticks to underlying skin. Just be careful not to reach the wound. It permits observation site and exposes site for cleaning. And if the dressing sticks to the drain, support the drain with the non-dominant hand while the dominant hand remove the dressing. Note the presence of odor and the amount, type, and color of discharge present in the dressing, if any. And then place the soiled dressing in the plastic bag or container for soiled dressing. And then inspect the wound's appearance, color, and drainage. And then remove gloves and dispose in the plastic bag. Prepare a sterile work area and then open the necessary sterile articles. So we have here a sterile gauze bag. So I will show you two techniques on how to open it. So first we do the dropping method like this. Open then drop and then dispose. The other one is by using the sterile forceps. So let's open like this. And then we use a forceps and then get the pad and put it in the sterile area and then dispose. So next, open the sterile cleaning solution and pour contents into sterile container with gauze sponges or cotton balls. So I have here a sterile cleaning solution. And I will going to use a 10 cc syringe to aspirate. and then pour it in a sterile container. And then dispose. And then wear sterile gloves. Unfortunately, sterile gloves are not available in the nearby drugstore in our community, so I would rather use a sterile forceps. Next, clean the wound with a gloved hand or sterile forceps and gauze sponges or cotton balls with cleaning solution. Clean the wound from top down or from the center to the outside. So let's do this. We get the cotton balls and dip it to the cleaning solution. And we can use the other set of forceps to squeeze the cotton balls until it dry. And then wipe. And then dispose. Another one. Wipe. And then dispose. And then last. Wipe. And then dispose. Next, if a drain is present, clean the drain from the center outward in a circular motion while the non-dominant hand is supporting it. Just make sure that the sponge and cotton balls are discarded after use. And then dry the surrounding skin with gauze sponge or cotton balls. We can do this until the skin becomes dry. And then dispose. Dispose. And then next, apply the pre-cut 4x4 sterile gauze over the drain if any. Next, apply sterile dressing over the wound. Place the surgical pad over the gauze to act as the outlet layer of the dressing. And then remove gloves. Secure the dressing with a tape. So let's tape the dressing. And then discard all disposable articles according to hospital policy. And then perform hand washing and then record the procedure and assessment findings. So this is how to perform cleaning sutured wound and applying sterile dressing. Thank you and God bless.